I'm Vicki Liviakis, and welcome to Body Beautiful. It's the show where we talk with local professionals about the latest in cosmetic procedures. We take your calls live on the air. With us today, we have plastic surgeon Dr. Thomas McNemar. He is followed by Michelle Miller from Simply Beautiful Body Wraps. Later, we'll be taking your calls and your emails, answering any questions you might have about laser and body wraps and cellulite and all that kind of stuff. The phone number to call, 800-440-4884. We'll also be posting the phone numbers to the guest offices, so of course be ready to jot those down. And our caveat here before we get started, any advice we give you today, you're going to also want to consult your own health professional. Welcome, Dr. McNemar.
Thank you.
Now, you're a plastic surgeon, and you do all that entails.
Anything from the facelifts to augmentations to
fillers, I imagine,
fillers,
the Botox,
and liposuction.
Okay, the standard stuff. But you're here to talk about something that's relatively new, and we always, like to talk about new things.
Well, it's not. The cellulite's not new, but the treatment for it, we have something that's new.
Yes, unfortunately, cellulite is not new, and it is not limited.
No, it affects about 85% of women.
And give just a little bit of background. I'm going to tease people here because you do have some new device that takes care of cellulite. But first, for those who are not that familiar with cellulite, although I can't imagine anybody out there is not familiar with it.
Exactly. Well, it affects 85% of the women. It's something that it's a skin condition, and what it is actually just underneath the skin you have fat cells that actually have too much fat in them, and they're held back by some reticular septae. And what happens is these fat cells will grow and be held back. The skin will be held back by these septae, and then what will happen? You'll get these bumps and whatnot, irregularities on the skin.
And so what we're looking at now is a video of.
Oh, this is the procedure, actually.
And let's just talk about what the name of it is first and what's going on.
Yeah, it's smooth shapes. And what happens is that you're seeing there is a fat cells after it's been treated, and the reticula that are going down, the septae, are the things that hold everything back, are actually becoming more relaxed over a period of time.
Okay.
So what you're doing is you're taking the fat cell, and what happens is with this, it's a photodynamic phototherapy that we're doing using light and laser. What you're doing is you're taking the fat cell, you're not destroying them like we do with radio frequency techniques, is you're taking the fat cell and you're actually releasing the fat, and then it goes into the lymphatics.
Okay, now I sort of buried the lead here. The procedure, the device that you're talking about, again, is called
Smooth Shapes.
Smooth Shapes, and it involves laser?
Laser and light, and rolling, and also and vacuum. And what this does is that you're specifically pointing out towards the light and laser therapy to the cell, the fat cell, and what that does is it makes the cell more permeable to the fat, and then it actually releases the fat into the lymphatics as you're rolling along. Okay,
now because it has the laser component to it, the obvious question is this procedure hurt?
No, it doesn't. It takes about 20 minutes to do, and it feels like a massage.
Okay, well that's not a problem, except the result is the cellulite actually goes away, or it's reduced, and how long does it take?
Yeah, it's reduced. To see the results, it usually takes you have 2 treatments a week, and that's for about a month, and it takes about 2 weeks to see the results. And the results last up to, at least 6 months, and it's FDA approved.
So I imagine lifestyle, diet, things like that will either enhance or detract from the treatment?
Well, you would hope that the diet and exercise would help, but even the elite athletes that you actually see will have cellulite.
Okay, that's a point I do want to make, because sometimes the skinniest women are still fighting cellulite.
Yeah, exactly, and it's not their fault. It's just genetics, hormones, vascular issues that cause cellulite. Okay,
we have the phone lines are already lighting up. Folks want to know about this, so we've got to go to a break. But for more information about Dr. Thomas McNemar, you can call 925-866-0177 or on the web, McNemarCosmeticSurgery.com. And for the first 25 callers, you'll be able to receive a complimentary consultation. We'll be taking your phone calls and answer some frequently asked questions about smooth shapes when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.
Welcome back to Body Beautiful. We are talking right now with Dr. Thomas McNemar, a plastic surgeon. We'll be taking your calls with any questions you might have about smooth shapes, is what we were talking about earlier, or plastic surgery. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, you're going to also want to double check with your own physician. All right, doctor, we were talking about smooth shapes. We have a video. So let's go ahead and roll that and take a look at before and afters here.
Right, on the left side of the screen is the before, and obviously on the right side is the after. And you can sort of see the dimpling of the skin, the cellulite, obvious cellulite on the left side, and then you can sort of see how it's smoothed out.
And that's after how many treatments?
That's after 8 treatments, and that's after 1 month. And you can sort of see how it's nice and smooth. And then the other thing too, you can see that a lot of people actually will go down in size too, with their dress sizes and whatnot, with the use of this technique as well.
Okay, so the one on the right, definitely not embarrassed to be out at the pool.
Right.
Quite nice. Okay. All right. Well, that kind of says it all. And that's after, you were saying that's after 8 treatments.
Right.
Some of the, before and after pictures we've shown, we also have some frequently asked questions. So let's go ahead and answer some of those. We've got several calls, too, waiting. So obvious question, how long does the treatment take, each treatment?
10 minutes each side, for example. So for that lady, it would have been like 20 minutes.
Okay.
And what's nice too is you don't have to come in and put a numbing cream on or anything. You just come in, have the procedures on. It's not painful. It goes very quickly, and it's like having a little massage during the middle of the day.
Well, let's just go right to the phone lines. I have Denisha from San Francisco. Good morning, Denisha. Do you have a question?
Hi, my name is Denisha. I'm calling from San Francisco.
Okay. Well, welcome to the show. Do you have a question for the doc?
Yes, I was trying to see. I'm only 25, and my cellulite is bad.
It sounds like you got your television set on. You're getting a little bit of feedback. But so you want to get rid of the cellulite?
Yes.
Okay. And it's not age really related, is it?
No, it's not. It's not age related. It's not diet. Usually, most people that exercise also get it, and it's not. A lot of times it's just genetic. And there's a lot of different treatment modalities out there, but the one that lasts longest is the smooth shapes.
Okay. Well, that's the one you're doing. That's what we're talking about. Should we go to Rose from Half Moon Bay? Good morning, Rose.
Good morning.
Do you have a question for the doctor?
Yes, I do. I don't know if you take care of this or not, but I have belly fat, which pulls on my back and causes me a lot of discomfort. Is there anything that can be done about that?
Well, I think you'd probably have to, first of all, come in, and I'd have to sort of see what you're talking about, and then we can go from there. I'm not sure exactly what that entails.
So that could entail weight loss, obviously, but then maybe liposuction?
It could be. That's another misconception, is that, well, liposuction is going to take care of the cellulite. Well, the liposuction is something that takes care of fat that's underneath where we're treating. And so, in fact, sometimes liposuction can actually cause it to be worse. Sometimes.
Okay, now we've opened up a whole other can of worms. Right. But let's go to Suzanne from San Jose. She's got a question for you Suzanne, are you with us?
Yeah, I'm here.
Hi, do you got a question for the doctor?
Yes, I do. I would like to know what's the best treatment for the upper lipstick lines, and can you put fat from one area and apply it to that area by chance?
Are you talking about
the longest?
Fat?
Well, usually people are talking about the wrinkles that are around the lips. And there's usually a combination of things that work for that, either some resurfacing and also some injections to help fill up those areas. And what's nice is you can actually define the line of the lip a little bit better with an injection and get rid of the wrinkling, usually a little bit of some sort of resurfacing, skin resurfacing.
Okay, Suzanne, I'm going to live dangerously here. We're almost out of time, but I want to go to Renelle in Oakland. Quick question for the doctor, Renelle.
Yes, my question is, I exercise 20 minutes a day, every day, and I still have cellulite. I'm just wondering, is it, like you said, just genetic? Is there any way that I can just exercise and not eat any fatty foods? Will that result in having smooth legs?
Okay, Renelle, we're going to get you a quick answer.
The answer is probably not. I mean, it sounds like you're already doing what you can do. You probably have done it, and you've probably tried every single cream known to mankind, as most of my patients have, and it usually doesn't quite work. What's nice about this process, you come in 20 minutes, you have the, twice a week for a month, and you'll have the kind of result that you probably want to have. Is this perfect? Absolutely not. You saw the before and after photos, but it works very nice.
Okay, thanks, Renelle, and I'm sorry. I apologize to the rest of our callers. We're out of time, but thanks for helping us learn a little bit more about this. For more information about Dr. Thomas McNemar, you can call 925-866-0177 or on the web, McNemarCosmeticSurgery.com. For the first 25 callers, you'll be able to receive a complimentary consultation. When we come back on Body Beautiful, we'll have Michelle Miller from Simply Beautiful, who will tell us everything we need to know about body wraps. We'll be right back.